Today I want to show you something that happens to home health nurses all the time. A nurse gets denied by Medicare, and the nurse thinks the problem was that the care wasn't skilled enough. But many times the care itself was completely appropriate. The problem is that the documentation didn't clearly show the skilled need. In this video, I'm going to walk you through a real example of a weak nursing note and explain why it gets denied, and then show how to rewrite it so the documentation clearly supports skilled nursing. Once you understand this framework, it becomes much easier to write notes that are defensible during a Medicare review. One of the biggest misconceptions in home health is that Medicare denials happen because the nurse didn't provide skilled care. But in reality, most denials happen because documentation doesn't clearly show the skill involved. The nurse may have performed a great assessment, they may have used clinical judgment, they may have made important observations, but if the note only documents the task that was done and not the clinical reasoning behind it, the reviewer has no evidence that skilled nursing was required. And when that happens, the visit can be denied. Medicare reviewers aren't in the home during the visit. They don't see the patient, they don't see the wound, and they don't see the nurse's clinical judgment. All they see is the documentation. So when they review a chart, they're asking three basic questions. Why was skilled nursing needed? What skilled care was actually provided? And how did the patient respond to care? If the documentation doesn't clearly answer those questions, the reviewer may determine that the visit was not medically necessary, even if the care was appropriate. Let's look at a very common example of documentation that seems fine at first glance. The note says patient tolerated wound care well. Dressing changed per orders and no complaints. Now many nurses chart something similar to this, and technically it is accurate. The dressing was changed, the patient tolerated it, and there were no complaints. But the problem is that this documentation only describes a task. It doesn't show why skilled nurse was needed to perform that care. When a Medicare reviewer looks at this note, several important things are missing. First, the documentation doesn't explain why skilled nursing was required for the wound care. Second, there's no description of the skilled assessment. For example, there's no mention of evaluating healing process, drainage, infection risk, or tissue condition. And third, there's very little description of the patient's response to care. Because those elements are missing, the reviewer may determine that the visit was simply a routine dressing change that could have been performed by a non-skilled caregiver. This is where very simple framework can help strengthen your documentation. Medicare reviewers are essentially looking for answers to three key questions. First, why was skilled nursing needed? Second, what skilled care was provided during the visit? And third, how did the patient respond to that care? When your documentation clearly answers those three questions, the note tells the clinical story of the visit. And that makes it much easier for a reviewer to understand why skilled nursing was medically necessary. Now let's look at how this note could be rewritten to better show the skilled care involved. Instead of simply stating that the dressing was changed, the documentation might say, skilled wound assessment performed to evaluate healing process, drainage amount, and infection risk. Dressing change completed using sterile technique per physician orders, patient tolerated procedure without increased pain or drainage, wound edges remain approximated with no signs of infection. Now, The documentation shows several important things. It shows a skilled assessment, a skilled intervention, and the patient response. This revised note works much better because it clearly demonstrates the skilled components of the visit. First, it shows that a skilled wound assessment was performed. Second, it describes the intervention that was carried out using sterile technique. And third, it documents the patient's response to that intervention. These elements help the reviewer understand that the nurse was not simply completing a task, but was actively monitoring the patient's condition and evaluating treatment effectiveness. This is one of the most important concepts in home health documentation. There is a big difference between documenting a task and documenting skilled nursing. A task might simply say, dressing changed, but skilled nursing documentation shows the clinical reasoning behind the care. It shows the nurse's assessment, decision-making, and evaluation of the patient's response. In other words, the goal of documentation is just not to record what was done. It is to demonstrate why skilled nursing was required to do it. If you're a home health nurse and you've ever finished charting and wondered whether your documentation would hold up during a Medicare review, well, you're definitely not alone. And this channel is dedicated to helping home health nurses write clear, defensible documentation that supports skilled care. Each week, I break down real charting examples, common Medicare denial reasons, and simple ways to strengthen your nursing notes. So if you want to feel more confident in your documentation, consider subscribing.